for the motion.
Thank you very much, sir. Thank you very much for that, sir. And now I would like our convener, Dr. Sumita Nayak, to address the meeting.
Thank you, Dr. Kushal. Good evening and a very warm welcome to all our esteemed colleagues who have logged into today's session. A very hearty welcome to our IAP dignitaries and our chief guest for this evening, Dr. Elizabeth Ma'am, our moderator, Dr. Pratima, and our panelists, Dr. Naveen, Dr. Anuja, and Dr. Pallavi. It's indeed an honor for me to introduce our chief guest for this evening, Dr. Elizabeth Ma'am. As Dr. Joseph just mentioned, she's the mother of nutrition of the country. Madam, first of all, thank you so much. As soon as I asked Ma'am to be with us on this session, she immediately said, yes, I will definitely be there. So uh, I have to introduce Ma'am officially. And Madam is the Professor of Pediatrics at the Anantapuri Institute of Research at Thiruvananthapuram currently. She was a former professor and head of pediatrics at the SAT GMC Trivandrum, as well as a UNICEF state consultant, and she has 40 years of teaching experience. We all know her field of interest is nutrition, besides which growth, development, adolescent health, diabetes, genetics. I think there's lots more to Ma'am's field of interest. And Madam's honors and awards, I think it will go on and on. She's been the state president of IAP Kerala for 2016, national president of Pediatric Adolescent Nutrition Chapter of IAP, IYCF Chapter Nutrition Chapter of IAP Kerala. Madam has numerous gold medals in her academic career. She's the course director for the basic certification course of nutrition in pediatric clinical practice. And Madam has 10 orations to her name. I think the most recent was at the National Pedicon, which many of us have attended. Ma'am, if I go on listing, I think we will be running into the time of our academic session. So once again, hearty welcome, Madam, Dr. Elizabeth Ma'am. Thank you so much. And requesting you to give a few words on today's session before we delve into the session. Madam, Dr. Elizabeth Ma'am.
Thank you, Dr. Sumita, for those kind words. I acknowledge the presence of senior IAPNs of IAP Karnataka, Dr. Jose, Vice President of CIAP, our panelists for today, Dr. Srinivasan sir, and dear friends. Lifestyle medicine is novel. Actually, I have heard of some YouTubers telling I am lifestyle medicine specialist, but when I went into the details, I found that they are not modern medicine people. They belong to Ayush, or they are self-proclaimed lifestyle medicine specialists. And we know that poverty has killed many people, but food has killed more people than poverty. And also, infection leads to morbidity and mortality, but lifestyle leads to more morbidity and mortality. And we know that we are sitting on a volcano of obesity, which is the mother of all NCDs. So our children are not normal. The pool of normal children is reducing, and malnourished are there because malnutrition is always there. And the survivors from the NICU, the preterm, the low birth weight, the high-risk babies continue to be malnourished. But many of them then change the path and suddenly become obese. And how many transplants, liver transplants are we going to do? How many dialysis units are we going to make? And what is going to be the lifespan of our children compared to their parents? These are all questions to be answered. And many of us know that we speak about nutrition, we speak about exercise, sometimes we speak about stress and sleep. But we know that lifestyle medicine is built on 6 pillars. So I'm also very eager to hear from the esteemed panelists and experts about this. This is a very novel idea, and it is the need of the hour. And if we modern medicine specialists shy away from speaking about it, other people will occupy that space. And what information they are going to give? They will be educating others through the WhatsApp university. So this is very timely and very proactive. And so I really support and congratulate the whole team. Over to Dr. Sumita. Thank you.
Thank you so much, ma'am. Thank you for those words of wisdom from your end. And indeed, yes, we are waiting. And before I hand it over to our MC of today, I recognize the presence and welcome our senior pediatricians. Dr. Kiran Agarwal ma'am is here. We have our own Dr. Kishore Baindur sir, Dr. Nagesh, Dr. Vanita Pangal, our EB, Central EB, Dr. Priya Shivali, and a lot of our EBs of IAP Bangalore and IAP Karnataka State. A very warm welcome to each one of you. I now hand over to Dr. Pooja, who will take forward the proceedings of the day. Dr. Pooja.
Thank you, ma'am. Good evening, everyone. I extend a very warm welcome to all the participants joining us today for this enlightening webinar. It is indeed privilege and honor to introduce our esteemed moderator for today's session, Dr. Pratima Kinney, ma'am. Dr. Pratima Kinney, ma'am, I welcome you, ma'am, for this session. She is a practicing doctor from Bangalore who completed her undergraduate training from Kasturba Medical College, Bangalore, and pursued her postgraduate degree in pathology from Bangalore Medical College. Ma'am is also a board certified in lifestyle medicine from International Board of Lifestyle Medicine affiliated with American College of Lifestyle Medicine. Apart from being a consultant pathologist, ma'am is a trained counselor and life skill coach, actively helping individuals improve their overall well-being through lifestyle medicine. Ma'am also serves as a co-chairperson of the Bangalore chapter of Physician Association for Nutrition and contributes as faculty for medical students through the Education and Ethics MIG of the Indian Society of Lifestyle Medicine at AIIMS, Nagpur. Ma'am, we are truly grateful for your valuable presence today and are excited to learn from your vast experience and insights, ma'am. I now request Dr. Pratima, ma'am, to kindly give the opening remarks for this session. Dr. Pratima Kinney, ma'am.
Good evening, everyone. Thank you, Jyoti, for the kind introduction. And I consider this a real honor to be addressing such a august audience of so many senior pediatricians from, different parts of India, I can say. And I'm looking forward to share whatever we have learned with lifestyle medicine, along with the other panelists that are there. Through the panel discussion that we have arranged for today. Thank you so much.
Thank you, ma'am, so much. Thank you. Thank you, ma'am, Pratima, ma'am. It gives me immense pleasure to introduce our esteemed panelist for today's session, Dr. Naveen D. Kinney, sir. Is a senior consultant pediatrician practicing in Bangalore since 1993. Sir holds post-graduation degree and DNB in pediatrics along with PG diploma in lifestyle medicine from CMC Vellore. Sir is associated with New Leaf Lifestyle Clinic as a consultant lifestyle medicine physician and has served as an executive board member 2021-2022. Presently, sir is an advisor for CMIC Computer and Medical Informatics chapter of IAP for 2025 and 2027. Sir has been a faculty at numerous national and state conferences and is widely admired for his contribution to the pediatric and lifestyle medicine. We warmly welcome you, sir, and thank you for joining this session, sir. Next will be our panelist, Dr. Anuja Pete, ma'am. Ma'am is a highly respected consultant pediatrician and lifestyle medicine physician with over 17 years of clinical experience. Ma'am is a diplomat in lifestyle medicine from International Board of Lifestyle Medicine and is associated with very renowned institutions including Nanavati Super Speciality Hospitals and many other hospitals in Mumbai. Ma'am is actively involved in clinical management of children with type 1 diabetes through the Juvenile Diabetes Foundation. Apart from her pediatric practice, ma'am is deeply committed to preventive healthcare and lifestyle modifications for both children and even adults also. Apart from her pediatric practice, ma'am has been board of directors at the Physician Association of Nutrition from 2024 to 2026, and presently ma'am is a part of advisors to the Pan India Physician Association for Nutrition India. Ma'am serves as a chair for education and ethics committee at Indian Society of Lifestyle Medicine, and she is also a mentor for ISLM certification course conducted in collaboration with British Society of Lifestyle Medicine. Ma'am is currently organizing secretary for ISLM Con 2026, which is the annual flagship conference of Indian Society of Lifestyle Medicine. We are truly honored to have you with us today, ma'am. And I also welcome you warmly for this session, ma'am. And next panelist will be our Dr. Pallavi Madhukuri, ma'am. Ma'am is a consultant pediatrician at Rainbow Children's Hospital, Hyderabad. Ma'am holds a post-graduation degree in pediatrics along with diploma in lifestyle medicine qualifications. Ma'am also serves as a co-director of the Physician Association for Nutrition Hyderabad chapter. Ma'am's dedication towards clinical healthcare and preventive medicine has been truly commendable, and we are delighted to have her as a part of today's expert panel. A very welcome to all our respected panelists. Thank you, ma'am, for joining us today. And now I request our moderator of this session, Dr. Pratima Kindi, ma'am, to kindly take over this session, ma'am. Dr. Pratima Kindi, ma'am.
Yeah, thank you. Thank you, Dr. Pooja, for all the introduction and the, taking this, starting the session. Can I share my screen? Okay, so before I start, I would like to thank you all for attending this so late in the evening after a busy working day of practice. But I am sure that you all are going to be, having a lot of, we are not going to disappoint you with whatever that you have been expecting. As Dr. Elizabeth had mentioned, this is really the need of the hour, and like we are plagued with the childhood obesity that is there, which is rising. So I just would like to give a small introduction about what, like a very small crisp introduction about what lifestyle medicine is and why is it that it has come about to be there. And actually there are courses which are being conducted in allopathic medicine where you can get certified as a lifestyle medicine physician. Okay, so I just want to share a few slides before we start the panel discussion. Is the slide clear?
Yes, ma'am.
You all can see
Yes,
it, right?
yes.
Yeah, okay. So as we had mentioned, the global burden of disease, what is ailing all of us, and especially in India, heart disease is still, or not just in India, all over the world, heart disease is still the number one killer for us. And in India itself, you see, 1 in 3 are having hypertension. 1 in 3 people are having hypertension, and this is one of the leading causes for heart diseases, right? And 1 in 4 are either diabetic or having pre-diabetes, and India has been proclaimed to be the diabetic capital of the world. And obesity rates are just rising. 1 in 2 have central obesity in India, and about 4 in 5 have dyslipidemia. Okay, and of course, the cancer rates are rising, and we are soon going to be the cancer capital of the world too. So, since I'm talking to pediatricians, I thought just sharing a little bit of the thing that is plaguing us. Of course, in India, we have the dual problem of malnutrition and overnutrition. But what is staring in our face is the rate of obesity and how the obesity rates are rising. So, in 2025, we have 41 million Indian children who are obese, and we are only second to China. Okay, and the alarming thing is it is rising by 5% every year. Now, in 2016, 2015-16, it was about 2.1%, and it has jumped to 3.4% in 2019 to 21. And if we see, it is said that 1 in 10 obese children by 2030 are going to be Indian children. And by 2040, we are going to have about 56 million children who are going to be obese. Okay, so this is where we are at, and that is why we need to question ourselves as to what is it that we are doing wrong. Why is it that these things are rising despite so much of advances in medical care? We have helped in treating infections. Now we don't have any starvation, we have enough food, but still the number of NCDs, the non-communicable diseases, are only rising, right? So probably we are so busy mopping the floor that we have forgotten to switch off the tap, right? That is what is lifestyle medicine about. Looking at the root cause, taking off what is actually causing the disorders. Okay, so we have 6 pillars, as Dr. Elizabeth ma'am had rightly said. But the thing is, in evidence, in lifestyle medicine, we are using evidence-based lifestyle therapeutic approaches. So this is something that has been proven and something that we know that works. And what are the 6 pillars? One is the predominantly whole food, plant-based way of diet eating, where we are looking at food as a whole and not other processed and the ultra-processed foods. Second pillar is having a regular physical activity or exercise. The third pillar is having adequate sleep. Fourth pillar is having stress, being able to manage our stress or coping with our stress. Fifth pillar is the avoidance of risky substance use. And the sixth pillar, the most important pillar, which is very, very rarely addressed in our medical field, is the maintenance of social connections. And we use these pillars to prevent, treat, and sometimes even reverse lifestyle related chronic diseases. So, where did it start? It probably had started during Hippocrates' time, because he has told that if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. So that many years back, Hippocrates had mentioned. But in 2004, the American College of Lifestyle Medicine was founded, and they have taken it forward. They spearheaded this lifestyle medicine program. And initially, we were all getting certified by the American College of Lifestyle Medicine. And then we have now got into the Indian Society of Lifestyle Medicine. So in India, we have this Indian Society of Lifestyle Medicine, where our vision is to have, look at the well-being for humanity. And it is also registered as a member of the Lifestyle Medicine Global Alliance and the WLMO, that is the World Lifestyle Medicine Organization. So Indian Society of Lifestyle Medicine now conducts exams. They have a course which is in association with the BSLM, and it is with the Indian context. Now, Dr. Anuja and me have got certified by the International Board of Lifestyle Medicine, which is affiliated to the American College of Lifestyle Medicine. But that was more on the Western thing. But now we had to learn the Indian context. Now, Indian Society of Lifestyle Medicine is having this program with the Indian context, and Dr. Naveen and Dr. Pallavi have got themselves certified from CMC Vellore, the PGDLM course that they are conducting. Okay, so this is just a brief about lifestyle medicine, how it has started and where we are at. So we'll jump into the panel discussion. So I'll start with the first question. I'm just sharing the screen so that the questions are going to be there, but the panelists will be talking with the questions over there. Okay. So the first question, I think this I will address to Dr. Anuja. In our daily practice, we constantly see children consuming ultra-processed food, ultra-convenient foods, leading to early obesity and metabolic issues. How can a busy pediatrician give parents practical, culturally relevant strategies to transition a household toward more whole food, plant-based way of eating?
Thank
Dr.
you,
Anuja?
Dr. Pratima. Thank you for that question. Firstly, I would like to thank Karnataka IAP for this wonderful opportunity. It is really great to listen to Elizabeth ma'am also, because all of us have learned from her textbook the basics of nutrition. Coming to my question, it is really a daunting task in front of us pediatricians to inculcate healthy habits in the whole family so that it translates to the child. So, a few tips that we can give in our busy clinics is to ask parents to not stock any ultra processed food in the home at all, to not to keep biscuits, chips, wafers, farsan, and all those convenience foods. Sometimes we keep in case we have guests, or whatever are the reasons. But we have to tell parents not to stock them at all. So when they are not available, they are not eaten. And parents need to plan a little bit ahead and keep a stock of fresh fruits, nuts, dry fruits, and plant seeds like pumpkin, melon, sunflower seeds. So these need to be kept available, readily visible, so that when snack time comes and the child wants to eat something, what is visible is the fruit or the nuts and dry fruit. So obviously they will snack on healthy things. Also, we need to train parents to involve kids in the grocery shopping and also in the meal planning, because when kids are involved with the food that is being prepared, they are more likely to accept that food. And finally, last tip which I would tell most parents, all parents actually, is wherever possible squeeze in more veggies. So sometimes visible veggies are rejected by children, so we want to ensure that they get the fiber, the antioxidants, vitamins, minerals from the vegetables. So wherever possible, we need to put veggies, like grate or chop veggies and put in chilas. Instead of the plain idlis, you can put vegetable puree into the idli batter itself, along with the chutney and the sambar. So the vegetable quotient of the food increases. And wherever possible, you can just chop the vegetables, steam, blend them, and put in your dals, or stuff them into parathas. So try to include as colorful vegetables as possible in the daily diet. So all these things together will definitely help improve the quotient. You're still sticking to culturally relevant food, and you're trying to reduce and eliminate the ultra processed foods, which are ultimately high sugar, high fat, high salt, which is inviting all these metabolic conditions.
Yeah, yeah. You put it so concisely and crisply in such a beautiful manner, Dr. Anuja. So essentially, you told that we need to crowd out whatever that the ultra processed foods that are there, not stock it in the house, and squeeze in as much as whole foods in a way that it is palatable to the child. Make it available, and also kind of mix it with the all the usual foods that they're eating, so that they get their fruits and vegetables without actually realizing they are taking it. Thank you so much for that answer. My next question is 1 minute. Yeah, to Dr. Naveen. So, parents are often deeply anxious about the growth milestones and frequently ask, if my child doesn't drink multiple glasses of milk or eat meat, where will they get their protein and calcium from? So, how do we confidently counsel? Because in whole food plant based way of nutrition, we are not focusing on having these animal products. So, how do we confidently counsel them in meeting their nutrition needs through a plant based way of eating?
Thank you, Pratima, and thank you, IAP Karnataka, for having us here, having me here. This is probably the most common question asked and the top source of anxiety for parents in our clinic. Parents are conditioned to believe that growth requires liters of milk and regular intake of meat. What we need to do is gently reassure them with solid nutritional science so that they can change their beliefs. I'd like to begin by pointing out that in underprivileged and undernourished children, where availability, affordability, and the amount of food is a problem, any source of protein and calcium, animal or plant-based, is acceptable. Also, lifestyle medicine promotes a predominantly whole food plant-based diet, not a completely plant-based one. As you can see from the image on the slide, which is from the latest ICMR guidelines, a little amount of meat and dairy products can be given to children. So when parents ask us this question, we first need to clarify that while dairy and meat are excellent sources of calcium and protein, they aren't the only sources. For example, calcium doesn't just come from a cow. In India, we have incredible plant sources too. 1 tablespoon of sesame seeds or til has more calcium than a glass of milk. Traditional grains like ragi are absolute powerhouses of calcium and even iron. If we include green leafy vegetables, curry leaves, lotus stems, cruciferous veggies like broccoli, cabbage, cauliflower, etc., we can provide our children with excellent bioavailable calcium. Similarly, protein. If you have a combination of traditional Indian grains and legumes, then it can form a complete protein profile. Say, daily intake of dals, soy products like tofu, edamame, soy milk, lentils like chickpeas, beans, green peas, grains like quinoa and oats, green leafy veggies like spinach, amaranth. If we have seeds like pumpkin seeds, chia seeds, nuts like almonds and peanuts, they're all high enough with protein to even serve the needs of an extremely active child. What we as pediatricians need to do is to reassure parents that if a child is eating enough total calories, that is, say, if a 5 kg child eats about 1200 to 5-year-old child eats about 1200 to 1600 calories depending on his activity levels, then a protein deficiency is virtually impossible. So to summarize, both animal and plant sources provide enough calcium and protein. But we need to remember that animal sources come with a baggage of high cholesterol, high saturated fat, and zero fiber, while plant sources come with high fiber, plenty of healthy fats, antioxidants, phytonutrients, and zero cholesterol. So, if I can compare protein and calcium delivery to products delivered on Amazon, it's like getting them delivered by an electric vehicle, which also cleans the road when you get it from plants, rather than a black smoke emitting diesel vehicle which pollutes the atmosphere when you get them from animal sources.
That's that's a very nice analogy, Dr. Naveen. Thank you so much for that. And if you can see the ICMR plate, half the plate is filled with fruits and vegetables. So we need to see that a food plate is divided with half the plate filled with fruits and vegetables. The other half, quarter of it should be filled with the whole grains, and the other quarters to be filled with the protein rich foods, which are the pulses, dal, lentils. And as Dr. Naveen has already pointed out, we can get sufficient calcium and protein also from plant foods. So we need to focus on distributing our food like the ICMR plate has told, and this will lead more to nutritional literacy and will prevent any kind of deficiencies that we can think of. So, these are the questions that we had for nutrition. Next, we'll go on to the question on exercise. Dr. Anuja, this question is for you. With heavy academic schedules and increasing screen time, structured playtime has been drastically, become less. Now, what are the realistic ways that pediatricians can encourage exercise as medicine, as we put it, for urban schoolgoers who may claim that they have no time or space to play?
So we are seeing a lot of underactivity and sedentary behavior right from childhood, going into adolescence and adulthood. The ideal recommendation is about 60 minutes of moderate to vigorous physical activity every day, at least 6 days a week. And when we compare the ideal, what is actually happening is way, way less. Many times the reason given is that we cannot find that a continuous 1 hour for physical activity with so many classes, other activities, school and everything. So what I would advise parents is to advise or to encourage kids to have exercise in small aliquots. We call them movement snacks. Like if you have some 5-10 minutes spare, you can just do jumping jacks or squats or lunges or even skipping or spot jogging or even dancing to some music. This works like a movement break, also adds on to exercise. And if you do 2 or 3 of these, so ideally the duration is 60 minutes, but it is proven that even a small amount of exercise, 2-3 minutes at a time, is also beneficial than no exercise at all. So small movement breaks where you can do some amount of exercise, 5-10 minutes, 2-3 times a day, also starts making you much more better physiologically. Also, I request parents to ensure that they and the kids are active all through the day. So rather than sitting for a long time, every 1 hour, take a 5-minute break, movement break, where you just walk around for some time. Or if you don't have space for that, just do all these exercises, like I said, jumping jacks or lunges or squats in one position. So some movement happens in the body. Try to use the stairs, do not use the lift too much. Try to walk small distances, use cycle wherever possible. So all these things also add on to being active. Also, parents, we can guide parents to plan the child's schedule such that they dedicate some amount of time for exercise classes or exercise in the entire day, may it be morning or evening. Because once we explain the advantage that exercise definitely improves cognition, concentration, and not just muscle and bone strength, and overall holistic growth and development, then many parents are more likely to try and fit in this into the child's schedule. Also, I tell them that between the ages of 5 to 12 years, kids should actually actively experiment with the different sports that are available. So, a structured training of any sport would also give them exercise along with all the positive things that come along with being a sportsman, that is, the sportsmanship spirit, working together with a team. So, all these are wonderful qualities which are ultimately going to help the child perform better in each aspect of life. So that is something that parents need to understand. So at each visit, I give a little of this to parents. So consequentially, I see a lot of difference in the attitude of the parents. Once they know that exercise is so important, they will start devoting more time and trying to manage the child's day that way.
Thank you, Dr. Anuja. So, like you said, every time they come, you give them little snippets of movement snacks, and those are also the snacks that you're giving them to know, and also educating them about why exercise is not only for their muscle and their bone growth. It also is for the cognition. That improvement also happens. So then that will make them definitely get them to enroll their children to do some kind of activity, and of course any kind of movement. It doesn't have to be a scheduled 60-minute, I don't have time so that I can't do, but within their house, however long, even small 10 minutes breaks can make a huge difference. Thank you so much. And next question is to Dr. Pallavi. We often see a mismatch where parents want their children to be active, but they remain entirely sedentary. So, how can we prescribe physical activity as a family habit rather than just like a chore for the child?
Absolutely. So, with urban families and nuclear families, this is what we see. Both the parents are so busy, either IT professionals or otherwise, so busy managing family and careers that their physical activity has gone for a toss. So here there are two things. Okay, first thing is not putting it as a blame for the parents. So first thing I do is I enroll the parents. So I ask them, so how was it for you when you were a child? What were your activities? And they come out with a lot of other things. No, for us, so we used to go out and play a lot. I used to be the cricket champion in my street, and or maybe in the fields. A lot of people give out those experiences, parents, even the mother. So this sort of gets them connected to the physical activity part, which they miss so many years. This is one thing that I would suggest that that the parents get connected to, because they've lost that out. Second thing I do is connect with the herself or himself. So asking them who is their model, which cricket, who is the cricket fan for them, and or who is the actor or actresses they like, and why? Because most of them are fit, and so I can use that as an example to be a role model for them. So when I connect these two, and then I can look at creating how to create fun times for them. It's not about exercise. The moment I label it as an exercise, it's like a huge, it appears like a huge burden, not only for the parent, for the kid also. It's like, oh my God, she's going to tell me, to do something. And they feel ashamed or intimidated, etc., which is what I want to remove. Make it appear very innocuous, and make it appear fun. So how do I do that? So I say, so what are the fun activities do you have? It's not like it has to be labeled as exercise. What are the activities do you do? What do you do for fun at home, family time? Where did you go out last weekend, etc.? So suggest more active family outings. What about going to a nearby, instead of a mall? What about going to a park or some sort of a resort or a farm area where they're exploring nature, etc.? So I'd connect them with that. That is one thing. So it's not about exercise, it's about more about movement. Like Dr. Anuja said, yes, exercise for 1 hour has been advised. Good structured play activity, all that, agreed. So that depends upon the child. How I encourage them to look at what sport they like, or what art form, maybe dance, etc. But more than that, it is about how to involve the family to create some sort of a social connection around activity. So it could be as simple as a pillow fight. So what are the fun activities do you do? Do you fight? Do you help your mom in the kitchen? And how does she do? Etc. Etc. So when they do that, and the mom says, yeah, she does help me, and then I give a child a high five. Oh wow, that's awesome, man. You're doing so much, etc. This encourages the child. So this sort of small activities at each visit, something new to point out to, where they can go out, maybe a family walk, a small post dinner, or just a little me time with mom or dad, whoever is available at that time. Just go out, your me time. So I suggest this to the parents too. Why don't you use this time to connect with the child? You go for a walk, or just a small activity, whenever you have it. It could be morning, it could be evening, depending on the times they have. But this sort of an activity itself counts as exercise eventually. Yeah.
Yeah, so something that the children can do with the parents, and without the parents actually being blamed for being sedentary, saying that, if you are not doing, how are you, expecting your child to do it? So without the blame game, playfully involving them to involve themselves and the child in some kind of an activity. It could be, like you said, a walk, or it could be a dance session, or they could just be playing in the house. So yeah, so that I think will be an easy way to involve the parents and the kids in doing some kind of physical activity. Thank you so much for that, Dr. Pallavi. My next question is again to Dr. Anuja, and this is on sleep. So, late night screen news and academic pressure are causing widespread sleep deprivation. We know that, and that is leading to behavioral issues and also poor school performance. So, if you can say two non negotiable sleep hygiene rules that you can tell parents that in a routine clinic, what will that be, Dr. Anuja?
Yeah, so we are seeing a lot of kids staying awake till late for various reasons. It can be academic studies, it can be just scrolling, screen time. And it is because even the parents are doing the same thing. And we want to change the entire family's sleeping habits to improve the sleep quality as well as the duration. So, the two things which are most important, I tell parents, is to avoid screens completely 2 hours before sleep time. So, and we typically try and tell them to plan sleep time around 10:30. So after 8:30, we avoid all screens, especially for children, and create a dim lighting, a soft soothing music, or a lot of quiet. Basically, it should not happen that there's a lot of things happening in the kitchen. Someone is tidying, making a lot of noise, news is on, there's a lot of activity happening in the house, then the entire household doesn't shut down for sleep. So we need to prepare an atmosphere of lighting, less noise. Also, routine bedtime activities.
which prepare the brain to kind of wind down and prepare for sleep, are very, very important. And when these are done sequentially every day as a routine thing, the brain learns to kind of wind down for that. And these activities can be for children, definitely, like, prepare your uniform and everything for the next day, pack your bag, see everything is ready. Also gives them a sense of ownership and responsibility for their chores. Then change of clothes or a quick shower or something, then brushing teeth, visiting the washroom, and then finally sitting on the bed, practice some rituals like, say, chanting something or abdominal breathing. So which kinds of helps them ground and bring them to the present, rather than continuously doing some activity or doing some thinking right till the time you are on the bed. So the deep breathing definitely helps them to calm their minds, and then they can sleep. Also, I suggest that there should not be too much variation between the weekdays and the weekends, because typically what they do is they feel I can catch up on my sleep on weekends, and then the not more than 1.1 1.5 hours of difference between the duration of sleep during weekdays and weekends. And that is how the body learns to kind of get aligned with the circadian rhythm. And then I think Dr. Naveen later will explain how that is very, very important for our healthy physiology. So these are a few things that I ask parents to definitely do.
Yeah, so if I'm just have to put it in a nutshell, one thing is, shutting down the screen time at least 2 hours, at least 1 hour before bedtime, and have a bedtime routine every day. And the sleep time should not vary too much between the weekday and the weekend. So try to keep it as regular as possible, and not that they can just stay for a longer time awake during the weekday and sleep longer in the weekend. That doesn't work. We need to have a regular wake up and sleep time during weekdays as well as the weekends. So my next question is to Dr. Naveen. Many parents don't recognize that chronic poor sleep directly contributes to childhood obesity and insulin resistance. How can we explain this biological link between sleep and metabolic health to parents in simple, impactful terms in a busy clinic?
Yeah. You have already explained the problem of obesity and how serious it is and how it's increasing. Parents, and for that matter, most teens, often think that sleep is just for rest. And so they sacrifice it for late night studying and scrolling. We need to explain to them the biology of the harmful effects of poor sleep in a simple way that they can visualize. What I tell my patients is, when your child is sleep deprived, their brain sends emergency signals to disrupt two major hormones, ghrelin and leptin. Ghrelin, the hunger hormone, goes up, leaving the child, making the child crave for high sugar, high fat comfort foods. And at the same time, leptin, the fullness hormone, goes down, meaning the child never feels satisfied and tends to overeat. Furthermore, when there is poor sleep, the stress hormone, cortisol, goes up, and this signals the body to store fat, particularly around the belly and around the viscera. And this leads to early insulin resistance. So, as far as metabolism is concerned, good sleep isn't a luxury, it's a necessity. And not just obesity, lack of sleep has multiple other effects. Consolidation of memory occurs during the latter half of a good night's sleep, that is, the REM sleep, which occurs between the fifth and eighth hour of sleep. Immunity is built during deep or N3 sleep. Growth hormone secretion occurs during sleep. So, therefore, children who have not slept well, in addition to the metabolic effects like obesity, hypertension, and insulin resistance, will have difficulty in remembering what they have studied, will have poor immunity, and will probably not grow to their optimum potential if they don't sleep enough. And I think this is probably something we pediatricians can drill into parents and even the children, especially the ones who are appearing for their board exams.
Yeah, so sleep is so important, not just to regenerate the tired body, but there are so many other active things that are happening, like you mentioned about all the hormones that are being secreted, how so many genes are actually being changed when the sleep happens. And of course, the tendency to eat more of the junk food when you are not slept enough. Even we as adults, we can see that if we have not slept enough, we readily want to just, if we are, there's an experiment that has been made that when you're not slept well, they kept the healthy food and the junk food, but the tendency was to eat more of the junk food than the healthy food. So sleep plays a very important role in our metabolic health also. So the next question is to Dr. Pallavi. We are seeing younger and younger children exhibiting signs of stress, anxiety, and school burnout. What are the simple age appropriate stress coping mechanisms or mindfulness tools that we can introduce during a short consultation?
Okay, this is a handful, Pratima, to be telling in a small consultation here. But then let me see what I can do. So, first thing I will say, if when a parent comes like this, we do face this. Yeah, all of us face this. Exam stress is a big thing. I see a lot of this scenario with parents who are relocating. Either from Bangalore to Hyderabad or from US to Hyderabad. A lot of kids come like this with stress, anxiety, and of course, psychosomatic diseases. So first thing I would actually focus is on normalizing the stress, and avoiding shame. The parents are already stressed out about this. So first, the consultation is really about coaching the caregiver themselves. So I would say something like children today experience chronic stress. There is pressure, peer pressure, and also overstimulation. This reduces the blame a little, and it is about coaching, core regulation. Like I tell, how stressed are you? Ask the parents, how stressed are you, or what's your life all about right now, and all of that. And most people give you really stressful scenarios. So just listening out to them reduces that. They always go back with a thank you, by the way. So calming the parent first, explaining that when they are calm about their stress, and giving the child a calm atmosphere, the child responds better to all of these mindful techniques, whatever I may tell right now. That is the first thing. So I always, the parent counseling would be about, creating a calm atmosphere. Look at creating some fun times, down regulate all this overstimulation, like has been told before, gadgets to the minimum, no sleep has to be prioritized, good nutrition, etc. No sugars, we all know that, etc. Apart from that, when it comes to the child and explaining, like you said, a technique to immediately regulate, for an older child, I would ask, I would actually question them. See, so what are you going through? What are your first, try to name what's happening. And they may say, I feel tight in the stomach, or the throat constricts, etc. So where in the stomach, where in the body do they, identify the stress with? First point. Second point is, can you name the emotion that is associated with it? These are mindfulness techniques. And I don't think I can do this for every patient, but yes, some patients, especially adolescents, I do take the time off and do this. So I explain to them some techniques. If they come with a panic episode, for example, a lot of panic today. In fact, today I had one child with a panic episode, and so I would say, what would you do next time it happens in a bus and everybody gets, totally flustered by this? So I gave her this thing, you can breathe into, we all think we all know this, breathe into a small air bag, or any plastic bag tightly around your mouth, breathe in and out for just a minute, slowly, as much. And it usually calms down. This is what we do in the emergency room for a patient like this. It usually works very well. First point. Second, another scenario I would give is, can you, if when you identify this thing in your body again, like a constricted throat or a tightness in stomach, this is a cue for you to start doing this tip. The tip I would give is, one of them is breathing, box breathing. 4 4. I'm not sure if people are aware. So breathe in to 4 counts, hold 4 counts, breathe out 4 counts, hold 4 counts. So this actually activates the parasympathetic system and calms the nervous system down, reduces anxiety. A few breaths also is enough. Or I could go ahead and do this, count your fingers, like go up and down your fingers, this way, like this. So breathe in, breathe out, slowly. Hold, breathe out, and again breathe in. Like that. This is a small technique that I teach them. The other thing I also do is, grounding, small techniques like, can you tell me 3 things that you can feel, you can see, you can taste, or you can touch, etc. So 3 things like this, and immediately grounds them, because it brings you back to the present moment. We all know this, but I make them do this exercise for a minute or two. The adolescent really gets it. It's not easy with a younger child. It takes longer time. In such cases, I do take the help of a psychologist. I think this answers the question, Pratima.
Yeah. I mean, I know it's such a deep subject, and it's very difficult to just put it all in a box in the 3 minutes that you've been given. Yes, children, we kind of draw an infinity line, and then we ask them to go along that infinity line. So when you're going up, you breathe up, and when you're coming down, you breathe out. So we give them that kind of a thing that, they go along that infinity line, so they can breathe in and breathe out. And like you said, the box breathing really works wonders. Many of them have told that this box breathing helps. And also we can do the mind distracting, where we ask them to, shift their focus from that panic attack to try to see whether you can see 3 things, and then 2 things that you can feel, and 1 thing you can smell. When you give that, then they calm down and come back to the present moment. So we had already told that the parents' stress can kind of affect the child. So Dr. Anuja, if children are internalizing their parents' stress, which manifests as functional abdominal pain or headaches, how can we subtly address the parental stress management as a means to cure the child's physical symptoms?
Yeah, so as pediatricians, we see so many times that children come with recurrent symptoms, right from functional gastrointestinal conditions in infancy itself. Like we see a lot of reflux, a lot of colic, and frequent visits for the same complaint. And that kind of guides us that there is something going on beyond the physical checkup of the child, which is usually absolutely normal. And then we try to delve deeper, just talk it out with the parents, and try to understand, where exactly there is stress or something happening in the family which might affect the child. So it is important to make parents aware that stress itself can manifest in many ways. It is not always a physical thing that is causing a symptom in the child. So many times parents are not aware. When it is abdominal pain, they will keep pushing. And once you have investigated thoroughly, you ultimately boil down to, there is no reason, nothing wrong with the child, but it still keeps coming. It boils down to stress. A lot of other frequent headaches, back spasms, leg pains. And also, like I said, in infancy itself, when the child cannot talk it out, they still can absorb this stress. So giving this insight to parents is important, that the child themselves may have their kind of stress, something as simple which we may not even perceive, is like the homework is unfinished, or the best friend is not talking, or the teacher scolded. So these seemingly simple things also can cause stress to the child, but the child is like a sponge, and the child is going to imbibe the atmosphere in the house. So if there is some subtle cribbing going on, some mismatch in the family members, sadness, anger, all these also reflect on the child subtly. So, giving this insight to the parents is very important. So, then they can retrospect and introspect and see if they can change those environment in the house which can impact the child. Also, appropriate referrals are important, because many times parents may not open up to the pediatrician about their own concerns and problems, but they will definitely seek help for the child. So appropriate referral where through the child, the parent also gets therapy is also important. So timely referral helps to a mental health specialist. And also we need to start approaching these functional symptoms with a dual prong, I feel, because we have been trained and we have been taught that first rule out all the physical things. If there is nothing organic, then you can consider stress. But in today's world where stress is omnipresent, we should not waste time just, seeking and digging deeper for organic problems. Along with that, we should simultaneously start tackling the stress as well. So as we investigate for a particular symptom, we should also simultaneously find out the triggers, and if there is any stress happening, try to sort that out by advising the child, the parent, with whatever level we can, and then appropriate referral simultaneously. So this will save a lot of time and will have a much better positive impact on the child's health. Also, we need to train parents to emotionally decompress themselves. So they carry a lot of stress from their office, and if they're bringing the same stress at home, that is going to impact the child. Also, many times parents ask pointed questions: how was school? How are your marks? What did you study? Did you finish your tiffin? So these are like question and answer interrogative questions, and many times children do not connect very well. So it is important to connect to the child emotionally so that the communication channel remains open. So rather than bringing our office or work stresses into the house, we need to mindfully, as parents, kind of, have a demarcation there and communicate better with the child non-judgmentally, so that the child is able to communicate their concerns to the parent, and then appropriate help can be sought.
Yeah, so very, very well put that. One is the double pronged, approach where we will approach the emotional as well as the physical part at one time, refer when absolutely indicated, and also trying to connect with the child with these open-ended questions rather than the yes or no, asking actually, how did your day go? What was your day like? And if the parent also can share with the child also feels like opening up. So some way the child will connect with the parent and say that yes, it's not that only me who is having a hard day, all of us have hard day, but we need to learn to cope with it. So this is a wonderful way of trying to involve the child and also not pass on the stress of the parent to the child. So we've going on to the next pillar, which is the addictive substances. Dr. Pallavi, while traditional substance abuse is a concern in older teens, younger children are facing a massive digital addiction, and vaping also is slowly creeping into the schools. So how can we screen for these modern risky substances early and effectively?
Yeah. So I think more important is like whichever visit the child has with us, either the adolescent or school age children, younger children too. Okay. Not just these risky. You said even digital addiction, right? So yeah, absolutely. The first questions I will ask is for the parents. Does how often does your child use the phone? What's their screen time? Does the child sleep with the phone? Does the child have a tantrum if you remove the phone? And how addicted is it? This gives you an idea of how much the child is addicted to. So parents can give us a lot. Now, usually for the parent, it is like, no, this is like accepted and normal. Parents even don't realize that the child is addicted. So unless you ask the questions, you will not we will not be able to assess this. So for example, the child is continuously on the phone, not going out to play, is on the phone and having very late night sleeps, disturbed sleep, doesn't get up well in the morning, is very irritable all the time, is obviously having some declining academic performance too, not willing to play with his friends, or not even able to relate to his or to relatives or people coming into the house, etc. All of these are red flags, okay, which should be addressed early on before it really escalates. For an older age group, like you said, vaping has also crept into the schools, etc. So look for some secretive behaviors. The child was actually very social and now is not. There is a decline in the school performance. He's very, cutting your conversations short, not replying or not even talking to you at home. Some small things that the parent may not immediately give attention to, but when you ask, these things come out. So how is your child doing now? How is the sleep time? These sort of questions. Now, these two, I would again address them separately, like addressed with the parents separately, with the adolescents separately. Now, when even a small one or two of things are small red flags for me to address this. So when I talk about these things, if I find even one thing, child is using more of recently more screen time, not talking, and even as you observe the child, you can see this. That the child is also, totally preoccupied, not willing to look into your eyes, is also on the mobile, even while the in the clinic talking to you, etc. These are all signs that there's something going on which you need to look into. At such times, I may even interrogate the child separately. Okay, so sometimes I do discuss this with the parent and the child, asking them, is it okay if I talk to the child separately? So that the child feels comfortable answering a few questions. If they are okay, then I send the parent out and talk to the parents to the child separately. So as adolescent pediatricians, we do have this head as questionnaire with which we address our kids. So you can head stands for asking about the home. So how is it like? What's your normal daily activity at home when you wake up? Very innocuous questions. Starts with very innocuous questions, and with your cues, you can go deeper with that. So that you get an idea of what's happening in the child's life. So with is it the home and the environment around it? How is the education or the school system going on? What are the eating habits and body image issues that the child may be having? Any activities or what about the peer relationships the child is having? What are any drugs, alcohol to be used? So as simple as that. What in schools nowadays, so then just in the newspapers we are seeing that vape is being used and heroin had been caught in that school. And what about your school? Did you see anything like that? Question like that, and the child may come out, yeah, yeah, of course, in my school too, that person, this person, etc. Then did you see any time? Did you try it any time? It's interesting. Let us see. Make it non-judgmental. That's the cue. Otherwise, nobody is going to open up. No child is going to come and tell you I'm addicted, obviously. So you need to be really non-judgmental and this is so important. You need to gain their trust. Otherwise, nothing is going to come out. So drugs,
Yeah.
alcohol, even sexuality, sex. I don't know. It's taboo. It's taboo in the Indian society. We don't talk. Parents don't talk. But I think we need to. We need to.
Yeah,
Teenagers are
like
all
you.
willing to talk if they see that you are a person who can be their friend. Otherwise, nobody is going to come out.
Yeah, I think you said that we have to kind of you the head assess that assessment. No, go about finding out if something is happening. Indirectly ask if something like that is happening in the school, and then probably get them to open up, and then you can catch it early before it becomes an actual addiction. Yeah, thank you, Dr. Pallavi, for that. The 10th question is for Dr. Naveen. We are seeing a disturbing rise in what can be described as food addiction, um, craving and compulsive eating of highly palatable ultra processed foods affecting both children and their parents. So how can you address this specific form of substance dependence within the family as a unit? Dr. Naveed?
Yeah, sorry. Yeah, all these days when we spoke of risky substances, we generally used to talk about tobacco and alcohol and to some extent drugs. But today, the most widespread socially accepted addictive substances in Indian households are ultra processed foods, loaded with what I call the holy trinity of addiction, which is silently sending SOS messages to our brain saying, stop. That is, they are SOS, sugar, oil, and salt. These hyper palatable foods like, say, instant noodles, packaged cookies, factory-made snacks, etc. They literally hijack the brain's dopamine reward system, which leads to both tolerance as well as withdrawal. So sometimes child may not be just throwing tantrums because he's a spoiled child. It may be just the child experiencing genuine cravings. And in many families, even the parents are in the same cycle, and they also use food to cope with their own stress. So to address this, we need to counsel parents using a few strategies. One, like Dr. Anuja mentioned, change the food environment. The home must be a safe haven, not a supermarket or a mini supermarket. If you stock the cupboard with chips and biscuits and Pepsi and Coke, the child will finish and will not rest till it is done. So we should gently tell parents, don't expect your child to have the willpower that we adults don't have. So if it's not in the house, it's not in the mouth. Or in other words, out of sight is out of mind. And the second thing we can suggest as pediatricians is to de-link food from emotion. In many Indian homes, food is used as a reward. Finish your homework and you'll get ice cream. Or sometimes as a comfort mechanism. Are you sad? Okay, let's order pizza. This normalizes emotional eating early in life. So we should gently urge parents to not glorify these ultra processed foods by offering them as a reward. We need to teach parents to reward children with experiences and connection rather than with calories. Just praise them with some words. Say, you have done very well. You've been a good boy. Or play a board game with them. Or just take a trip with them to the park or the museum. Just by treating highly processed food as a substance that requires boundaries, we can help the entire family break that cycle of food addiction and help them to reclaim their health.
Yeah, like you rightly said, the whole family has to be involved. It's not just the children. And replacing the reward as an experience rather than the food will add much value, and the child also will feel good about it. And you're adding the next pillar that we are talking about, that is the social connection, which is so less these days. Dr. Pallavi, if you can take this question. So the digital devices are largely replaced face to face, the peer interactions that we are not seeing these, less of it we are seeing. And so, how can we advise parents to foster this deep, real world social connections for their children?
Yeah. So we all know this, of course, that children develop emotional resilience through real life interactions, not from by entertainment or information or games. Um, so parents also know this. So how do I normalize this? This is nice. Instead of saying cut down devices, etc. Um, we need to encourage parents to actively create fun time together. Maybe family meals, of course, without devices. Neighborhood play, going out and actually playing, creating fun games together. Family games together. Similarly, visits to, we have all forgotten this, visits to relatives or coming, impromptu visits by others into our houses, shared hobbies, uh, even shared meals, cooking times, outdoor activities, etc. Children actually need, so I think even educating the parents is important here, because most people have, parents have actually forgotten that this is important. Team sports is important. Human interaction is important. Unstructured play, playing for no reason. There is no need to win, nothing. It is just simply playing. It's so important, an opportunity to learn to negotiate, to wait, to lose, to repair conflict maybe, and to develop resilience. Read expressions, even facial expressions. Children need to learn this, even tolerate boredom for that matter. So these skills are built socially and not digitally. Simply telling this to the parents, I think this itself initiates them to start working on this. So encouraging disease-free rituals, like I said, no disease-free, device-free, sorry, bedtime, one family outing maybe weekly, without devices, can we devise that? Can you even think of that? Talking about these things also makes them start thinking about these things. Now parents are going to model teacher parents sorry children are going to model parents only, so parents need to model this behavior. So how is their activity around devices, getting them present to that? Are you talking in front of your child all the time? Are you using the phone all the time? Are you actually talking to the child or looking into the phone while talking to them? Small things, keeping the phone aside while talking, looking eye to eye when you're talking, or having being actually present, are small things that you can get the parent present to, which they can model and which the children are going to learn from. Yeah, these are small things that I would go ahead.
Yeah, I think it's very important that the parents have to be a model to the child as to how the real time, peer to peer interaction is going to, when the parent does, the children do. But I just got to know that, India has the highest Instagram users at 230 million, and about 31% of social media is being consumed by the teens. So just trivia there, okay? So then the 12th question is to Dr. Naveen. In our fast-paced, digitally driven world, children often struggle with a sense of vacuum or a lack of direction. So since we are talking about social connection here, how can we guide parents to use what we call as the PERMA model? The full form of the PERMA is there on the left-hand side, specifically focusing on nurturing deep relationships, a sense of meaning, and a true feeling of purpose to build long-term psychological resilience in their children. Dr. Naveen?
Thank you. See, in these days of nuclear families and children having long commutes to school, stressful school atmosphere, etc., these children are feeling lost and directionless. So I think a wonderful way to show them, to try and change that, is to use Martin Seligman's PERMA model, which we can give parents practical suggestions to help with this. So in PERMA, the P stands for positive emotions. That means cultivating optimism and gratitude in the child. And one of the best ways to do that is for each family member, say at the dinner table, to describe one good thing that happened today and write it down. So over a period of time, you'll have a long list of things that, when you read it, you feel, okay, this is something I should be grateful for. And so this helps cultivate optimism and gratitude in the child. The E in PERMA is for engagement. That means finding activities that spark curiosity and also puts the child in a state of flow. A state of flow would be like, they lose track of time without using their screens. So activities like drawing, building blocks, reading, puzzles, word games, anything that can keep the children occupied without them having to actively reach for their phones. That's engagement. The R in PERMA is relationships, building strong, supportive bonds with family, peers, and teachers. And one of the best ways to do this is to have the family meal at least once a day where no phones are allowed. Eating at least one meal a day, like Anuja mentioned, helps keep communication channels open. Nowadays, we see that, wherever families go, each person is on their mobiles and there's hardly any talk that's happening. So a device-free meal at the end of the day will keep communication channels with the child open, which may help the child to open up about more serious problems as they grow up, like bullying or depression or anything like that. The child will feel that, okay, there is somebody who's going to listen to me. So maintain relationships with your child. M is meaning, helping children have a sense of purpose and belonging. Children feel purpose when they realize that they matter in this world. So giving them, involving them in some activities like, say, packing old clothes together to donate, or feeding a stray animal, or helping a grandparent read their smartphone, or volunteering at a charity or even at a temple, or helping with family chores. So these give children a sense of purpose, and they realize that, okay, my contribution also matters in society. So it gives them a feeling of purpose and belonging. And the last, the A, is accomplishment. Children always revel in praise and appreciation from at any age. Even I feel happy when somebody tells that I've done a good thing. So set small achievable goals and celebrate the effort, not the result. Praise their hard work rather than the result. So saying things like, I'm so incredibly proud of how hard you studied for your exams. I know that you've given it your best. Or say, if a child is learning to swim, you can say things like, even though the practice was tough today, you didn't give up. Or, I love how patiently you shared your toys with other children. So appreciating small acts of the child will will make the child feel that he has accomplished something. And if such small changes are regularly implemented and encouraged, there is a high likelihood that these become permanent habits in these children. That's PERMA.
Yes, yes, that's a nice way of saying perma and saying permanent. I had yet another experience with another talk when we had given. They said that you've spoken so much about connections and all that. Maybe you should change the acronym from PERMA to PREMA. So the thing of where you're, spreading love and affection. So I thought that was also a nice way of, to put it. So before we open the floor to the audience, let's look inwards. We've been telling what we are going to be telling our clients, how our patients and our children what they should be doing. But as busy professionals who are balancing our careers and our home life, can each one of you tell about a single or any lifestyle change that you made which has had a very big impact in your well-being, so that you can spread this knowledge among the other doctors who are here, and the first-hand changes that you have seen? Any one of you? I'll stop sharing so that any one of you can start talking.
Yeah, so I've been quiet for some time, so I will start. So we are all aware about all these lifestyle pillars. We have learned about them to some extent in our undergrad as well as postgrad education, but we are never really aware fully, and we never really fully implement them for various reasons. But with after studying lifestyle medicine, I kind of rethought about all that I was actually doing. I was preaching something, maybe not following that 100% myself. So I decided to make those changes right from the food. So I started switching to whole foods, plant predominant foods. I started reducing dairy in my diet. I found wonderful improvement in the bloating and the heavy feeling, the stiff joints once I eliminated dairy maximum. Of course, in social situations, it still becomes a little difficult, but I try to minimize it wherever possible. At home, I do not use dairy products at all. And I have reduced my animal product consumption. I'm a vegetarian, so it's very easy for me to not have non-veg at all. Dairy, cheese, paneer was something which was tricky, but I have learned to have alternatives which helped me transition. And now, after a lot of whole food, plant predominant eating, your palate resets and you don't require to have so many of those addictive foods basically. So that is one thing. I try to be consistent with my exercise, and I find that that also helps me manage my stress better and improves my productivity in the clinic. So it's a win-win. And finally, I realized that I was having erratic dinner times because I start my clinic a little late. I start at 7, and then it ends at whatever time depending on the season, how busy or light we have. And I realized my body was not adjusting well to the various different times. I sometimes used to eat at 9, then 9:30, 10. So I decided to, anyways, we know early dinner is good. So now I have my dinner by 6, 6:30. After dinner, I go to clinic, and then I am not really waiting for the patients to get over so that I can run home and eat my dinner. I am really satisfied, and I have a full 4 hours gap before I go to bed. So that also has immensely helped my physiology. So these small changes, once we start implementing in ourselves, give us more confidence to start explaining to patients as well. And somehow I feel once I do it myself effectively, uh, it somehow reaches my patients and parents, and they also follow suit rather than me just telling them without doing myself. So that has helped.
Yeah, thank you. Thank you, Dr. Anuja. Yeah. Next, Dr. Naveen.
Okay. So I've been non-vegetarian for all my life, sometimes even almost once or twice a day. And I used to think that, I exercise, I am not overweight, so I'm in good health. I run a lot, I run long distance. But one thing I steadily saw in myself was that my HbA1cs were going up from 5 to 5.4 to 5.8. It reached 6.2. And my blood pressure also slowly started creeping up with age, even though my weight was, I know my BMI was normal. I exercised a lot. But that's when I realized that something needs to change. And I started adopting a predominantly whole food plant-based diet with, almost nil dairy. And of course, other changes. I started closing clinic early. I started exercising more. I started, stress management. I slept better. I slept for longer, and lo and behold, my HbA1c started coming down. And the last it came down was around 5.1, I think. But then there's a flip side. Last year, our son got married. So marriage means all, celebrations, travel, lack of sleep, unhealthy food. And about 10 days back, 15 days back, when I checked, again, HbA1c is back to 6. So that teaches us that lifestyle change is not something which is one time. It's a lifelong process. You need to work on it. But then when you really give it your all, you can bring down most of these non-communicable diseases without resorting to medicines. I'm not on any medicine right now, and I hope to not have to take it all my life.
Okay.
Dr. Patavi.
Yeah. So an awesome hearing from Anuja and Naveen, and I'm so happy to have this question from you, Pratima. Gives me a chance to really boast about myself. So yeah, can I have permission to share something impromptu?
Yes. I think you can share.
Yeah.
Yeah.
Just to tell a little about myself, so I have been diagnosed with a seronegative arthritis 6 years back during the COVID time. Okay, so this is me right now, of course. Can you see my screen here?
Yes. Yeah.
Okay, I think it's all not so. Yeah, is this better? Can you see my screen now properly? Yeah. So this is about me. I just wanted to share. So I was diagnosed with RA, rheumatoid arthritis, 6 years back, totally bedbound actually. I had to take 2 months off from my hospital at that point of time just to recover enough to be able to see just 10 patients in 24 hours. Just 10 patients that would totally make me again, come back and sleep the whole day. So it was that bad. And it took me a year to recover. And I had been on research about this lifestyle and have incorporated all these practices right from then by myself, not that I had consulted anybody, just out of my own research. And when I did find all these changes, so I had stopped medicines. When I found that medicines are not helping me, it is this that is helping me. So I stopped all of this and started doing the whole food plant-based diet, the exercise, the intermittent fasting. There's so many protocols for the anti-inflammatory diet, etc., etc. To have come to this stage now. So it makes me really feel proud, and this is what I advocate to my patients too. So I show them the green smoothie that I have every day. I show them the salad box I have every day. So it's there in my table when they come, and I show them this is what I have. I actually open that and show them. So this is what helps me. And now you know what I'm going to do. Pratima, thanks for giving me this opportunity. So I'm going to show them this. Okay, this slide. This is me on a trek. So just 10 days back was a trek. I was just telling Dr. Naveen I was on a trek to the Annapurna base camp in Nepal. It's a beautiful trek. I think everybody should try it out. But oh my God, I didn't know it was so tough. But I could do this. I'm having RA. I can do this. I did use medicines, Combiflam, for a few days, but that's about it. I am not on anything for the last 6 years. So with RA, I know if anybody of you have RA, you know what it is to have an RA. And I am, by the way, fully practicing pediatrician right now. I do see my 50, 60 clients a day, inpatients, everything, and night duties too. Okay. So, and yes, I did it. Went to the base camp all by myself and came back. Big achievement. So I'm really boasting here. So this is going to be on in my clinic, to show off to my to my patients. That's about it. Thank you, Pratima. Yeah.
This is fantastic.
Parents.
Congratulations.
Yeah.
Really, it is something very, very commendable. Congratulations, Dr. Pallavi, on this. Thank you for sharing that. So it goes to show that lifestyle really makes such a big difference. And since you all are all practicing it, and whatever you all have told is that we need to make small changes. We need to make baby steps. Start small. We don't have to do a change straight away, and we need to focus on consistency over perfection. The other thing is I'm very thankful that we got this opportunity to talk to so many doctors, because all of us doctors need to talk the same language. We need to be talking to all our clients the same things, and all of us have to be on the same page. And likewise, it's not only for the children that we are telling, the entire family needs to follow it. And unless that happens, it's not that, you do this, but I'm not doing. So we need to practice what we preach. And we've seen that from the stories that you all have shared, that when you're doing it, it is easier to kind of incorporate or, tell our clients how to go about living their lifestyle. So we need to, whatever that you all have spoken, we need to focus on these 6 pillars, correct? So, and the 6 pillars, when we start with one pillar, it is like a domino effect. Like you start having exercise. When you do exercise, you're feeling good, you're having the endorphins that are coming in, you're going to be sleeping better. When you sleep better, you wake up fresh, you want to eat better food. And when you eat good food, and especially with the microbiome changes, when you're having more fiber in your food, your mood is going to elevate. Your exercise is also helping in your thing. Your mood is going to be better because of that. Your capacity to manage stress is going to be better. When you're happy, you're going to be connecting with more people. You're going to have your family, your friends, your get-togethers. So all kinds of, and it started with one thing, with this exercise, and, each one follows the other. So I think we need to start somewhere, the main thing is finding our why. Why do we need to change this? And when we have that answer, we will get to do this. We need to know. So whatever is your why, just put it there. And we should not forget that in trying to help our clients, we should take care of ourselves. This self-care is very important, because when you take care of yourself, you will be able to be ready to take care of your clients and your patients. Okay. So I just want to conclude with this. I just had a small thing, some resources that we can kind of share with the clients for ourselves. Sorry. So these are some resources. If any one of you want to know more about lifestyle medicine, you all can, just take a screenshot of this. There are a lot of information. All of this is evidence-based, and it is going to be telling you how to practice this also. And I also want to invite you all to our ISLM Con in October, which is being conducted in Hyderabad. Anyone can register for this. So I'm just going to leave this here so people can kind of scan. You can register. Please do attend so you get more knowledge and more ideas about what is lifestyle medicine, and we can implement this not only with our clients but also in our lives. Okay, and if there are any questions, the audience have any questions, I think we can take it. The panelists are ready to answer. Yeah.
Yes, ma'am. There is few questions, sir. There from Kishore Bendur, sir. Sir has asked, are we being weaned away from animal-based food to a more wholesome plant-based one? But the paradox in India is that with economic upscaling of the society, the accent is more on consumption of non-veg food. Can you please give a comment on this, ma'am? Anuja Pete, ma'am, or Pallavi, ma'am?
Uh, no. I'll just continue with where I just put the question. Wonderful talk. I went through all of that. In fact, I'm also seeing the cricket match going on. So partly the sport is also there. And nice points that have been given by all of you on lifestyle things and etc. But it's just like if you look at the Indian system of life and the way of life that we had all along, it is just like, are we reinventing the wheel is what is happening. We did talk about all of this, what you talked, the six pillars, the food, etc., has been mentioned in our ancient wisdom. But only thing, along the way we lost track, and then I'm good that we are coming back to all of this: good sleep, food, habits, discipline, things like that. So excellently brought out by all the three speakers and well moderated by Dr. Pratima. It was a very meaningful discussion, and there's lots to talk, but then good. Thank you very much. It's quite late in the night, so keep this up, and so that we also can inculcate this into our day-to-day practice. Thank you very much.
Thank you, Dr. Kishore. Yeah.
Thank you, ma'am. Thank you, sir. There is one more question from Dr. Vinay. How far only stressing on consumption of food rather than how to increase absorption of good food by good gut health? Sir is asking.
Yes. So, can I take that?
Yes, ma'am. Yes, ma'am.
Yeah,
Please.
yes. So it is very, very important to focus on good gut health because gut-brain axis is a very important aspect where the gut actually has an impact on the brain and vice versa. There is a gut skin axis, there is a gut immunity axis. So ultimately, the bottom line is your gut needs to be healthy. And for a healthy gut, we need a healthy gut microbiome. That is the healthy bacteria that reside in our intestines. Now, these bacteria, we can consider them as probiotics. Now, they need their food, which are prebiotics. So, if we give appropriate food to these bacteria, the good bacteria will thrive and flourish and the colonies will multiply, and the bad bacteria will automatically reduce and will improve the gut health. Now, why this is important? Because these bacteria will process the prebiotic to create certain postbiotics, that is something like short chain fatty acids, which in turn are helpful in reducing insulin resistance, will reduce chronic inflammation. So, the gut is really in the center of all this physiology. Now, how to improve gut health is simple. Rather than consuming probiotics from outside all the time, we need to let our innate gut flora kind of thrive and flourish so that that particular personalized gut flora will thrive for that particular person. So how do we do that? By a whole food plant-based eating pattern. Because when we say whole plant foods, fiber is only available in plant foods. And fiber is the prebiotic that is required for the gut bacteria to have their postbiotic and their metabolism. And if we do not give enough fiber, we have seen immediately we see a lot of gut issues, constipation. But It also makes the gut leaky, because when these bacteria are not given their food, they will start eating the mucus layer, and then it will lead to a leaky gut where the toxins will be absorbed in the system which are not supposed to be absorbed, and these toxins in turn will have their negative impact on our metabolism. So a whole food plant predominant eating pattern where we are having 50% of our plate with vegetables and fruits with the peels intact wherever possible is going to give us a lot of fiber. Whole grains, again, when you don't use polished grains, the bran and the outer cover is intact. It's going to give us a lot of fiber. Also, whole legumes, lentils, pulses is going to give a lot of fiber, along with other macronutrients and micronutrients, antioxidants, polyphenols. So it's a win-win. We don't really need to consider and calculate our macros when we have this healthy plate concept, and we focus on whole plant foods.
Thank you, ma'am. There is one more question from Dr. Vinay itself. Sir is asking about egg. Can you comment whether we can avoid or we can take, especially in children's like less than 6 months? I'm asking this whether we can take before 6 months, when we should start before 6 months or after 6 months of age.
So
Can I
firstly,
answer this?
go ahead, go ahead.
Yes, sir, sure.
Sorry.
There are
And
so
there's
many
one more
controversies
question.
actually, sir, for this. Even I
Yeah,
have.
I thought I'll answer the other question also. There's also another question on when to add dairy and its products in children, and when to introduce salt, sugar, and oil. And there's one more question. How many? Okay, what comment on a dairy-free diet? Is it applicable to everyone? So, like again, I'd like to stress, we are not saying be completely free. What we're trying to tell people is that we have to reduce the amount we are consuming of all these products. So, one practical suggestion I give my patients is, for the first 2 years of age, try and avoid. Get the children used to as many fruits, vegetables, whole grains, pulses, dal, sprouts, nuts, seeds, etc. Because these are the foods that are rich in fiber. And these are the foods that help the child to develop a very good microbiome. And we now know the importance, like Dr. Pete said, about the gut-brain axis. So let the child develop a completely healthy microbiome and a good gut by consuming all these stuff and getting used to it. What happens is, the moment you add things like ghee or cheese or butter or salt or sugar, their taste buds get aligned to that higher quantity of salt, and they induce the dopamine surge in the brain. So once the brain gets used to that high amount of sugar, salt, and oil, all these fruits and vegetables go out of their diet. So, and that's what's happening to most children. Most children don't even eat a fruit or a vegetable on a regular basis. So introduce them slowly in as less quantities as possible. Dairy is definitely not required for the first 2 years of age, because we recommend mother's milk. Mother's milk is for our children, cow's milk is for the calf. So there is no need to introduce dairy for children below the age of 2 years. Later on, introduce it in a limited manner, not in the amounts that they are consuming. And especially the way the dairy industry is going, with all the nonsense that's happening in the dairy industry, the farther away we stay from it, or the lesser we have dairy, the better.
Can I add something to this too, Naveen?
Yeah,
Pratima,
please.
is it okay? So I think you're going very gently with this, Naveen. Okay, I go a little more aggressive with this. When I say no dairy, it is no dairy. That's it. Sugar is an ultra processed food. It is junk. Junk is junk. It's always a no. So when a parent asks me this, or anybody asks me this, I say, why do you want me to say yes to a junk? How can you expect me to say yes to junk? Junk is junk, that's it. Now I think as a civilization, we are not able to say no to the Western standards. So in India, sugar was not there before, right? It was introduced maybe a century back from the Western side. So the sugars we knew were date sugar, palm sugar, jaggery. Even that we used to use once in a while during festivities, not every day. Not every day. Right now, if I say yes to sugar, to the parent who's I say yes to sugar, they're going to use this every day. You know that, and I know that. So I never say yes. First point, including dairy. So, like you said, cow's milk for the cow and human milk for the human, and that's it. Period. So all my parents who come to me, they are either on mother milk or no milk. That's what I say: mother milk or no milk. Now, unless I think if we start this, it is not going to happen, Naveen. This is what is my take on this. I'm a little passionate about this. So, yeah, and I know it. So, what I tell my parents is, see, you know that your parent had a heart attack when he was in 50s or 60s. Now we are hearing of 30s and 40s. I know, you know, that our children here, the ones we are mentoring here, are in for problems in their 20s. We all know that, we are seeing it. We see we have avalanche of autoimmune disease conditions, and you can go on and on. I can go on and on. You know that, and I say that's what I want to prevent. So I always tell the parent, what is it that you want? What's the future you want for your child? What's that you can do for your child? That when they come to your age, how do you want them to be? And you start here. So I'm very clear that this is it. So unless your home is free from ultra processed food, etc., it is never going to happen. So saying yes to a cake, yes to an ice cream is a no. So I give them the choices. There are vegan alternatives. Please go ahead. Yeah, every city has it. I show them. I give them all the ones available in Hyderabad. Definitely yes. So I would also request all of you to have a look at videos of Dr. Brooke Goldenberg. She's a pediatrician based at US, practicing whole food plant-based diet and anti-inflammatory diet since last 20 years. She has raised her children on this sort of a diet, and a lot of information out there that she gives out, and she treats patients like this. It's awesome, a beautiful read also. Please go ahead.
Just to add to that, Brooke Goldenberg was she was diagnosed with systemic lupus erythematosus, SLE, and she just changed into this diet, and she's been off medication, and she's been symptom free for the past that many years. She went on to get married, to have children, and she was given just a few years, and they said that her kidneys are going to go. But when she got onto this diet, she's made a remarkable recovery. Yeah.
Absolutely.
Yeah, I think there is another question on, I think Dr. Vinay has asked about egg.
Yeah, so can I come in here?
Yes,
So we
yes,
just
please.
complete the egg and dairy part.
Yeah.
My personal experience with parents is, how much ever I am convinced, because I have done a lot of research, I have practiced on myself, so I have that conviction. But when I make it a blanket thing, sorry, Dr. Pallavi, but when I want to get compliance from the parents, I have really faced a lot of resistance when I give a blanket no to certain things. So I have to go by their food habits and their family culture. And when many of them ask me about eggs, ideally we do not need eggs at all. But if some family is keen on giving eggs, I suggest egg yellow after 9 months, and egg white and yellow both after 1 year. And that also not more than 3 eggs per week, because there is strong research which says that anything more than 3 eggs per week will add on to the risk of diabetes and cardiovascular disease. So we need to, I educate them that we can have eggs, but as far as you are having a lot of fresh fruits, vegetables, sprouts, green leafy vegetables. So I do a lot of positive prescription where I tell them more of what to eat, so that crowds out the negative foods which they are used to eating. And then just not more than 3 eggs. Again, when it comes to dairy, like Dr. Naveen also said, we do not really need milk or any white liquid for that matter for our nutrition. We can seek calcium from better sources. We can seek protein from better sources. But if some family is very keen on giving, I would say after I try to stretch them to 15 months, 18 months, many times we see a lot of CMPA babies. And for them, we have to give complementary food advice where we do not involve any milk at all. So all my babies, CMPA, no CMPA, I do not advise them to give any added milk, even like a porridge or something in the complementary food. Till 1 year for sure. After 1 year, depending on the parental resistance, but I make it very clear that you can give it occasionally just to understand whether the baby is accepting it well and not having a lot of side effect. For CMPA babies, definitely beyond 18 months. And if they are tolerating also, don't make it a routine habit. You can give it occasionally. When you are out, you have less control. But at home, you make sure that you are giving all these, the four things which are very, very important, which I keep stressing is vegetables, fruits, sprouts, green leafy vegetables. So definitely no salt till 1 year of age. They do not require physiologically. Later, also beyond 1 year, half teaspoon in the entire day of our common table salt. And no sugar till 2 years, obviously. And after 2 years, also, I tell them that since you have already gotten used to using dates and dry figs and raisins and all that, why do you want to suddenly make sugar a daily thing? So I have seen that for the child, the parents also make a change. And then once I tell them that you don't need to give it on a daily basis, occasionally where you have no control, occasional outings, even food can be used as an enjoyment, but on rare occasions, like don't make it a reward. And you're out with family, you are at a hotel and you're having a dessert, okay, that sugar from there can go, but don't make a habit of ordering in or making sweets and desserts every alternate day at home, or have jam and roti and all those things. So when, and they are with us since birth, so we keep prepping them and giving them these small, small things of advice. And I have seen families make a good change in the adult's health as well. So I go by their acceptance level and tailor make my advice depending on that.
Yeah.
Totally agree with you, Anuja. Yeah.
I think,
Thank you
Sumita,
so
no more
much,
questions.
yeah.
Can we?
Yes, I think we've had a wonderful session
Already
today.
11, yeah.
Yes.
So,
Yes.
other day I was just going through the original Mahabharata written by Vyasa, not by others like that, where exactly whatever the life habits were there during those days were just recorded there. It was interesting to know that during those days, they used to have only 2 times food. There is no breakfast at all. It is around 10 to 11, one food, and in the evening, between 5 to 6, they used to have another food. So no dinner and no breakfast. And people, if I go by the things like that, Krishna lived for about 125 years, and other Pandavas also lived around 150 years. And of course, Bhishma lived for 600 years. That's the thing like that one. So except for the pediatrics, I don't know what the pediatric, children used to get there during that time. So what is the opinion of the panelists about having only 2 types of food and now nothing in the dinner? Before the sunset, they should finish up the food. Any idea about that
We have
one?
been following this for quite some time.
Very
It
good.
takes
Very
a
good.
little bit of getting used to. So
Yeah.
we have Pratima and we have breakfast and lunch by 4, and that's it. So
That's it.
our last
Good,
meal of the
good.
day is at 4 o'clock, and it's made a wonderful. All my parameters are again coming down to normal. I feel more energetic. My cholesterol has come down from 250 to 230 to 150 when I last checked. So all this without medications. So
Very good. Very good.
it
Very
works.
good. Good one. Yeah.
So
Thank
I
you.
would like to add that whatever we have spoken are all evidence-based. Indian systems and our traditions all have recommended this, but there was no evidence, and it's difficult to talk in our platform as an allopathic practitioner without evidence. So I also searched out all the evidence. What are the studies for this? And I really found studies for each of this, whatever we have talked about right now, and more.
Okay.
Yeah. Dr. Kushal?
Okay.
Madam.
Yeah. Kushal, we can finish. Yeah.
Yes, sir. So thank you for the wonderful session. I appreciate our chief guest, panelist, and our moderator for wonderful session on Kesamanvai. And I would like to look forward for these type of sessions more than anything. Thank you very much. Thank you one and all.